If you're like most people that are living with a bursitis or a tendon injury, be it a hip, a shoulder, a knee, what you're looking for is to work out whether or not physio is the best solution or perhaps an injection is the best solution. And today we're talking about the pros and cons of each and what you need to consider before you get that injection. I'm Chris Fawcett from the Headache and Pain Management Centre here in Brisbane, and I've been treating issues like these for many years. And I'm here to tell you that when we're talking about injections, they're really kind of, how can I put it, it's an easy option, okay? Because what the thought is behind it is that if you get the injection, the pain goes away, okay? Now, that might be the case, but a lot of the time, it's not, all right? Now, when we're talking injections here, we're generally talking about a corticosteroid with a local anaesthetic, okay? And often it can be used as a diagnostic tool, but sometimes it's used for a treatment tool, okay, to get you apparently back on track, all right? Now here's the problem. Depending on what it is that you're looking to get injected, whether it's a bursa or a tendon, there's really mixed evidence about its effectiveness of what you get injected and at what time, okay? So for some people, what we find here at the clinic, they present with a very localized pain, whether it be sort of right on the point of the shoulder or right in the point of the hip. And the advice from us is actually to get that injection more as a pain relieving mechanism, okay? To almost open a window for us to start the treatment. And this is really useful for people that are in a lot of pain, like it's extremely sensitive to touch, and there's a lot of pain there. And it's basically a pain relieving mechanism to get to the root cause of the problem, which is more a biomechanical issue, a muscular issue, or perhaps a rehabilitation issue with a tendon. So when we're talking about injections here at the clinic, what we're usually looking to do is to use them as a pain relieving mechanism first, and then get into the strengthening, get into the conditioning that needs to work to get it better long term. Because rarely do we see anything about a bursa or a tendon being a localized one problem thing. It's usually the tip of an iceberg, right? There's usually some muscular issues around the hip or the shoulder that can cause these things to happen. Now, here's the problem. If it's being advertised to you as, the be-all and end-all fix, the evidence doesn't suggest that that's the case, okay? So for a lot of people, they can get the injection, it's good for a couple of days, and then the pain comes right back, and that might be you, and that's why you're listening to this video now. For some people, it's a month, some people it's 3 months, and other times it just has no impact at all, other than the couple of days the local anaesthetic's in there. Either way, if you get the injection or you've had an injection before, it gives us good evidence and good data as to what has worked for you and what hasn't worked for you. So it may well be that there is a bursitis in there, that you inject it, it gets a little bit better, but then it comes back. And that tells us there must be an issue with the biomechanics or the muscles around it, so we need to rehabilitate those, and we've got the equipment in the gym to be able to do that. Okay, so what my advice would be to you if you are getting or thinking about an injection or thinking about whether physio is the thing for you, it needs a tailored approach, okay? Everybody's different, it's not a one-size-fits-all thing. I would suggest seeing a physiotherapist first and getting a diagnosis around not just the very obvious thing that might be on a scan, which may or may not be the relevant thing, but getting to a physio, making sure that what you're looking at on the scan matches up with what the symptoms are that you're experiencing, having a test of all of the muscles, the joints, and anything else that's relevant around the area to see if there's other factors that are at play, and then working with your physiotherapist to work out if an injection is the right thing now to make sure that we either get pain relief to get the rehabilitation going, okay, or it might well be that we try some conservative treatment first. If it gets better, great, and if not, then the injection comes later. But basically what you need to do is you need to have a good look at all the things that are happening around the area, so not just the spot there on your shoulder or the spot there on your hip, but have a look at the strength of the muscles, the movement of the joints adjacent to it, to see what also might be causing that issue. Because the last thing I want you to do is to have an injection, spend the money to do that, take the risks of any reactions or anything like that, and then all of a sudden it doesn't work and you're back to square one, okay? It's usually a lot more sort of detailed than just getting into the joint, jabbing it, and then hoping it's all gonna be okay, because while it does happen sometimes, it's quite rare. It doesn't happen as much as you might think, and it doesn't happen as much as others might be saying that it does for you. And that's just from 15 to 20 years of real world experience, just giving you some free advice on that one. So if you're thinking of the injection, Go see a physio first, get that full assessment of the area around it, and then work with your physio to work out if the injection's the right thing for now, or it's something that can be put off with a bit of conservative treatment first to really ascertain what's happening from there. I hope that's been really helpful. If that's been interesting, you'd like to reach out for more detail, please reach out. You can follow us on Facebook, YouTube, Instagram, all the socials, and you can get some more information from there. But until next time, I'm Chris from the Headache and Pain Management Centre, and we're all about strong solutions and smarter physio.